Hi, I'm Natalia. Today I'm going to talk about hand, foot, and nail care. I'm going to demonstrate how you should do hand and fingernail care too. So, let's go to the video. Now, just let's talk about the guidelines that you have to follow during hand, foot, and nail care. So, hand, foot, and nail care, there are the guidelines are the do's and don'ts during this procedure. So, for cleaning nails, you have to use clippers. Scissors are only allowed if you are permitted to do so. According to facility policy, clip and clean nails are allowed usually using clippers. Do not use regular scissors. According to state law and facility policies, you have to use clippers or regular scissors are not used. And cleaning and trimming nails are easier and immediately after the nails have been soaked or bathed. So when nails are softer and smooth, it's easy to clip the nails. So the next one, avoid the use of nail files and other sharp objects. So other sharp objects means usually the files and those things that could clean your nails. But the orange stick is a disposable pointed wooden stick that can be safely used. And when trimming nails, very carefully, you have to do the procedure and accidentally do not clip or damage the skin. And if you observe any sort of anomalies such as redness, cracking, or signs of infections by the fingernails or toenails, report it to the nurse. And clip the nails straight across, then round the edges with an emery board. Push the cuticles back with washcloth or dull end of the orange stick and dry the feet well. So you have to dry the feet well and carefully dry between each toe so that inspect for red or cracked areas. Moisture promotes fungal growth and skin breakdown, so this can lead to serious complications. And the next one is that next step is that a lotion can be applied to hands and feet if the skin is dry. So do not apply lotion between toes. When you apply lotion between toes, it may also cause certain complications. So now let's go to the demonstration. So now you can see the demonstration of the fingernail care. So first step is to assemble the equipment. So the equipments I have gathered here are the basin, you can see here, and a bath thermometer, and then the soap, the bath towel, and the lotion. You have to use a plastic protector as I have mentioned above in the procedure section, and then nail clippers, emery board, orange wood stick, and a nail polish if the patient allows, and water. So the water you should have at 105 Fahrenheit. So now the first step is to fill the basin with warm water at approximately 105 Fahrenheit. So now I'm pouring the water. You have to pour water and then ask the patient to soak the hands inside the water. When pouring water, the patient's hands should not be in the basin. After pouring water only, you have to ask the patient to put the hands in. And now, to retain the heat, you have to put the towel around the basin. Now you can see I have put the towel around the basin so it retains the heat of the water. So soak it to about 5 minutes and remove the patient's hand before adding water. So add warm water if necessary. Wash the patient's hand. Push the cuticles gently with washcloth or an orange wood stick. A cream may be used to soften the cuticles first sometimes. use a soft brush or an orange wood to stick to clean under the nails. So to clean under the nails, you can use a brush, a soft brush. Now you can see I'm cleaning under the nails with this soft brush. If you are using an orange wood stick, you have to check with the nurse before using the orange wood stick if the patient is having diabetes or not. And the next step is to dry the patient hands with the towel. So now you can see I'm drying the patient's hand with the towel. So now to cut the fingernail straight across in the manner which you have to cut the nails in this straight cross way, you have to use the fingernail cutter, that means nail clippers. Do not cut below the tips of the fingers. Below the tips of the fingers you don't have to cut. You don't have to cut because if you cut it may injure the skin around the nail. So keep nail clippings in the protector to be discarded. So you have to collect the nails that you are cutting out, and then you have to discard them accordingly. You have to shape and smooth the fingernails with an emery board. So I'm having this nail clipper. So with this nail clipper, I'm using this one to this part of it to shape the corners of the nail. So now let's I'll demonstrate how to cut the nail. So you can see I added a paper to collect the nail cuttings. So I'm cutting the nail. And then I'm using this emery board to shape it, shape the edges. Likewise, you have to cut the rest of the nails and shape the edges with the emery board. And pour a small amount of lotion on your palms. And gently smooth it over the patient's hand. And now you have to discard these nails. And the next step is that you have to empty the water from the basin, gather the equipment, clean and store it according to the facility policy. So now then return the overbed table to the foot of the bed. If the patient has been sitting up for the procedure, assist the patient to go to the bed and carry out the ending procedure actions. So thank you.